Good evening, everyone. Welcome to our Education USA session programs in the US that we are organizing today with two public health schools at US universities, Rollins School of Public Health at Emory University and School of Public Health and Information Sciences at University of Louisville. Let me start with the introductions first. I'm Dr. Monica Sapia and I'm your moderator for today's session. Before I introduce the panelists, I would like to introduce Education USA. Some of you might know Education USA that is hosting the session today is a US State Department network of over 400 international students advising centers in more than 170 countries and territories across the world. Education USA, through its well-trained advisors, offers accurate, comprehensive, and current information about opportunities to study at accredited institutions in the United States. So Education USA is your official source of information on US higher education. Education USA has laid out 5 easy steps for students for their US university applications. And these are the 5 steps that are on your screens. I'm not going to get into the details of it. If people are interested, we do offer a lot of sessions online. Students can attend those sessions and know more about these steps. Education USA has 7 centers across India. These are some of the services on the screen that Education USA offers through these 7 centers, which are located in Ahmedabad, Bangalore, Chennai, Delhi, Hyderabad, Kolkata, and Mumbai. Today's session is being hosted by the Hyderabad Center, and I'm the regional officer for the Education USA Hyderabad Center, also an Education USA advisor. I'll share with you at the end of our session various ways through which you can connect with Education USA. So let's move on with the introduction of our panelists. We are joined today in the webinar by Ms. Yvonne Foisy. Yvonne, can you just maybe wave your hand for our audience for them to see you? She's from Emory University. We have Ms. Deepti Jain and Ms. Tammy Thomas, both from University of Louisville. Yvonne has over 20 years of admissions experience in various institutions across the United States. She began her career in admissions in Boston, Massachusetts, where she served at 3 institutions, including Boston College. She currently serves as Senior Director of Admissions and Enrollment at the Rollins School of Public Health in Atlanta, Georgia. She has worked closely with international students and is passionate about providing access to higher education. Thank you so much, Yvonne, for joining us today for the session. Ms. Tammy Thomas has been with the University of Louisville for almost 19 years. She's the Assistant Dean of Student Services and Undergraduate Education. She's responsible for the Office of Student Services as well as directs the undergraduate program. Tammy has extensive knowledge and experience in the areas of admissions, academic advising, curriculum development, as well as project management. Her passion is helping students meet their long-term professional goals. Thank you so much, Tammy, for joining us today. Deepti Jain has been working as an in international student recruitment and advising since last 8 years. She's currently working with the University of Louisville, Kentucky, and specializes in admissions for public health degree programs. She was born and raised in India. She has an great understanding of the Indian education system, and she has worked in various positions in India advising students for study abroad. As I mentioned earlier, I'll be serving as the moderator for the session today. It's a great privilege to moderate the session, being not only, and bless you. It gives me a great privilege to moderate the session, being not only an Education USA advisor, but also myself being a product of the US education system and a researcher and academician from the field of public health. I did complete my Ph.D. in the field of healthcare from Penn State, and then was associated as a researcher with Duke University in one of their overseas campuses, and more recently as a faculty of public health in India, before I started my current position with Education USA at USIF. With these introductions, let's look at how the session is going to go today. I will start by putting a few questions to the panelists on behalf of our audience. These questions will revolve around understanding the field of public health, career opportunities in the field, what kinds of backgrounds are fit for the field, types of programs and application requirements, both undergraduate and graduate level programs, and finally, the scope of research in public health. We will spend about an hour in these questions and answers and then open up the platform for audience to ask questions. Audience can see a questions box on their screens where they can type in their questions. Be careful, there are two boxes there. There's one for comments and one for questions. Make sure that you put your questions in the questions box. All panelists will be able to read these questions. If there are very high number of questions, we apologize in advance that we may not be able to answer all of them, but we will try our best to take up as many questions as possible. So now, since now that we've understood the format or the outline for our session today, let me start with the first question, opening up for our panelists. And my first question is for Ms. Tammy Thomas from University of Louisville. Tammy, can you please share with the audience who may not be aware what really is public health and what do public health professionals do?
So one of the great things about public health is that it's a very broad field, and public health, really the goal is improving the health of a population, and that population can be anything from a neighborhood to a city to a state. It varies depending on what the issue is. And when you look at what public health professionals do, it also is extremely broad. Given the current COVID crisis, the words epidemiology and contact tracing has been in the news quite a bit. And those are key components of what public health professionals do. Those are only a part of what public health professionals do. Epidemiology, of course, is the study of disease. And then contact tracing is actually examining who a person came into contact with if they were sick, in hopes of figuring out how the disease is spreading and if it spread to those people. But public health runs the gamut from biostatistics, biostatisticians, which look at the actual data and crunch the numbers, to health behavior and health promotion. So looking at how to change a population's behavior. With COVID, we've seen everything from wearing a mask to cover when you cough, to cover when you sneeze, washing your hands, using hand sanitizer, and of course, one of the things that everyone has heard is social distancing. And that is a lot of those things that you've seen recently are all related to health behavior, changing a person's behavior. Then you have epidemiology, which is the study of disease. So tracking the disease is one of the key factors, one of the key jobs that epidemiologists often do. So they're plotting where the disease is, the disease itself may have what they call a hot spot. And you also heard of that quite a bit with the COVID crisis. And we haven't heard as much of it in the last couple of weeks, and hopefully those hot spots won't be popping up again. Then you've got environmental health. So what are things that can be done to prevent environmental health hazards? And if you're a public health professional, it can be anything from writing policy, it can be advocating to change policy, it can be examining the data, it can be collecting the data, it can be monitoring the data, it can be looking at ways to change people's behavior, whether it's through a social media campaign or an actual printed poster campaign, things of that nature. So when you think about public health, there's not one thing that you do as a public health professional. It's a very broad field and requires lots of different skill sets depending on what area you're passionate about. And for a lot of people, they don't necessarily know that what they want to do in public health, but they have an idea of what their skill set is and what they're interested in. And the great thing is we can usually talk to that person or sit down with that person and help them figure out what options are available within the area of public health.
Great. Thanks, Tammy, for such a great explanation. That's wonderful. Moving on, my next question is for you, Yvonne. can you please elaborate on various disciplines of study under public health? And also, are there any public health related associations in the US that students may refer to if they want to know more about the field?
Sure, thank you. And continuing to build on the wonderful information that Tammy shared, many of our students learn and understand rather quickly that the work of public health is highly interdisciplinary. And so even as you're selecting a field of study at the various institutions that you will come to know as you're looking for graduate studies, know that many of our students have been able to forge career paths even outside of their major course of study because of the nature of research in public health, because of the nature of this interdisciplinary field. That truly is an advantage for you as a student to have the ability to be part of a field that will lend itself to flexibility. You won't be boxed in, as it were, and you'll have lots of opportunities to work across disciplines. Having said that, we encourage our students to think about the skills and natural inclinations that they have as students when you are selecting a major. So as an example, if you are a student who loves to work with data, who's fascinated by numbers, who loves the aspect of sort of figuring out a puzzle, then something like biostatistics or epidemiology might be a great match for you. Traditionally, those disciplines offer students the opportunity for research, for working with large data sets, identifying how data can help us to understand public health. If we were to use COVID-19 as an example, epidemiologists would be looking at the spread of COVID-19. They would be looking to understand how quickly that spread is happening, what is the best way to contain it. And they might be working with biostatisticians to understand what are the implications of spread, to understand any missing data sets that might still exist as we continue to know about this disease and as we continue to understand further. Many of our students in these disciplines go on to work for local, state, and federal governmental agencies, as well as consulting companies. We've seen even private sector companies as of late even hire epidemiologists, knowing that it is important for all of our workplaces to understand the meaning of public health. If you are a student that really enjoys working with populations, you envision yourself not sitting at a desk, but in the field and understanding and educating the population around public health. As Tammy mentioned, if you're looking to educate, if you're looking to implement programs, then a discipline such as behavioral sciences and health education might be a great match for you. Our behavioral scientists look at ways that we can educate and change behavior for the benefit of public health. So again, using COVID-19 as an example, they might be launching an information campaign. I know here in the United States, when we turn on our television, we have many public service announcements and commercials talking about the importance of hand washing, of wearing a mask, of continued social distancing. Those are all great examples of public health campaigns. And so behavioral scientists look to develop these, they look to change our behavior for the betterment of public health. Environmental health looks at the ways in which our environment can link to public health. And so thinking about and using again COVID-19 as an example, our environmental scientists are looking at things like the impact of seasonality on COVID-19. Is it the case that vitamin D might help curb the spread of this disease? Are there certain regions of the globe that will be impacted differently based on things like pollution or weather patterns? And so a very important part of public health as well. And environmental scientists also conduct wet lab experiments, and really those are scientists that are looking at the impact of the environment, both at the molecular and the large scale level, to understand those linkages. And we also have global health as a discipline that is very common in many American schools and programs of public health. And global health always looks at and concerns itself with the inequities that can happen as we look at the spread of disease and as we look at access to health care. And so we seek to help our students understand what are some of the underlying social components, what are some of the underlying structures that impact access to public health and that impact public health outcomes. So again, you would see COVID-19 as an example here in the United States. Unfortunately, we have a large instance of underlying health issues. Many people presenting with things like diabetes and high blood pressure. I know this is unfortunately also the case in India. And so global health seeks to understand those different health systems, to understand how we can help each of those countries or regions or communities be successful in providing access to public health. One last note as we talk about disciplines, when we receive grants here at the Rollins School of Public Health from NIH or CDC, oftentimes our researchers and faculty are working in teams. So we might have an epidemiologist, a biostatistician, and a behavioral scientist working together. So again, please remember that public health is very flexible and highly interdisciplinary.
Yvonne, are you still there?
I'm still here.
Oh, okay. I stopped. We didn't hear you for a second, so I thought.
Oh, okay. Sorry.
Okay, you're there. Okay. All right.
Yeah.
Do you want me to move to the next slide?
Yes.
Okay.
And
Yvonne,
I'm sorry.
do you want to talk about the?
I'm sorry, I'm not seeing the slides on my screen.
Yeah, me neither.
Really? Okay, because this, wait, just hold on. And if you're able to see the slides,
No.
wait. That's so strange. Can you see them now?
No.
Just hold on.
Organizations. Now I can. Thank you. And
You can
so,
see that? Okay,
yes.
perfect. That's perfect.
Thank
So I'm
you.
sorry about that. I had them all the time and I was just flipping them. I'm sorry about that. Okay.
No problem. And so there are some organizations that you can research to help you get to know some of the programs that are available in public health here in the United States. Our accrediting body we call SEEP, and they accredit schools and programs of public health and can really help provide some great information around competencies and what you should be seeking to understand by way of delivery and approach of each of our schools and programs of public health. The Association of Schools and Programs of Public Health is an advocacy organization. They also provide information and guidance to schools and programs of public health. Their website is very helpful. You can use it to search programs by location, by topic area. There is even a scholarship search tool available on their website. So I encourage you to look at these organizations as a resource to help you select programs of public health.
Perfect. Thank you so much, Yvonne, for the very nice explanation of the various disciplines of study. So Tammy, I turn back to you, and the next question I pose to you is, now that the students have understood various disciplines of study in public health, can you please share an outlook on public health careers in the US with our audience today?
Okay, so a couple things that you would want to keep in mind is that in the United States, the current public health workforce, much of the workforce at the time that they came into public health was not required to have a degree. And those people are starting to retire. And now most public health professionals and most agencies, such as local and state health departments, are requiring degreed professionals in those positions. And they have accreditation requirements to meet now, and that is one of the requirements. In the United States, it used to be that you could work in public health and learn on the job. While you still get that learn on the job opportunity, most places do now require a degree. And so we've seen a large uptick in the area of public health with enrollment and the fact that students want to pursue this profession and want to work for local, state, and federal organizations, and therefore need a public health degree. The Bureau of Labor Statistics estimates that approximately 16 million positions will be available by 2022 in the field of healthcare. And healthcare is a very broad field that includes everything from clinicians to public health practitioners. And when you look at that number, that was an estimate pre-COVID, and we've seen a large push for hiring in public health jobs at the moment. And out of something bad, of course, came something good. Up to this point, many people knew that they were involved in public health, or such as getting a flu shot or washing their hands, but they may not have really had or known the name of that particular. Most people feel like it's part of healthcare, and public health has been interwoven in everybody's lives for a very long time. It doesn't get a lot of publicity. So with COVID-19, we've seen the fact that people are talking now more about epidemiology and contact tracing. And the United States over the last 4 weeks has seen a large push in hiring public health professionals to be contact tracers and another position called communicable disease investigators. And those are people that are going to investigate if someone is tested positive. They work with the contact tracer, and they're going to start to look at things like where that person has been, who they've been in contact with, have they self-quarantined, have they not quarantined, if not, why, and looking at things that we can do as a society to help decrease the numbers of COVID positive patients. So right now, those are probably one of the biggest areas that we're seeing growth in for contact tracing and communicable disease investigators due to the COVID crisis. But another area that is growing is health data analytics. And what that is doing is looking at the data related to healthcare. So it can be anything from if we're seeing a large uptick in a heart disease in a particular area, why is that happening? You know, looking at the numbers to try to figure out, is it across a particular socio-demographic population, things of that nature. So we definitely have seen between health data analytics and biostatistics, if, as Yvonne said, you're very quantitatively inclined, those are areas that you may want to consider. Health behavior and promotion, that's also kind of gotten a spotlight with the COVID-19 crisis. How do we change people's behavior, and what do we do during an epidemic or a pandemic? And then once that curve begins to flatten, what types of things do need to continue? And that's with health behavior and promotion. So again, the hand washing, the social distancing, the wearing a mask, things, all of those things are tactics to help change our behavior that needed to be emphasized as a result of COVID. Then you've got health administration, and many of us saw health administration also come to the forefront with COVID because of all the things that needed to be talked about as far as cost of the disease and management. How were hospitals managing the disease? What were they doing to care for patients? The fact that we ran short of PPE, and how were we getting those supplies? All of that falls under health administration and management. It's really the business aspect of public health. And then you've got health policy. So things like travel restrictions and shelter in place, things that the US hasn't seen in a very long time as far as sheltering in place. And health policy is really looking at the issue and trying to figure out the existing policies that are in place and policies that may need to be created. And then, of course, epidemiology is the study of disease. And right now, if you're in epidemiology and you're interested in COVID, there will be a wealth of information over the next couple months relating to it, and probably for the next several years until there's a vaccine created. So out of something bad with COVID, public health has really been put in the spotlight. So we feel like at this time, we really need to take advantage of the fact that we've got this opportunity to highlight the importance of public health and let people know the vital positions that public health professionals play, especially, you know, in the wake of a pandemic. As far as job outlooks go, if you look at what public health professionals really are, they're really included in three aspects: assessment, policy development, and assurance. And all of the positions within public health play a part in some of those or all of them. So things like being an analyst or a clinical health care practitioner, or you may be an educator, all of those are critical public health positions. And due to COVID, there will most likely continue to be growth in this particular career field. And our job is to make sure that you all have the best tools and information available to go out and be successful in those fields that you choose.
Great. Thank you so much, Tammy, for giving such a bright view of the careers in public health, especially, you know, I think a lot of mention that both Yvonne and you have done is about the COVID-19 and how it has actually changed, you know, a lot of perspective for the public health professionals. So thank you so much, both of you, for your insights into the specializations, and then following that, the career options that the students can choose after a public health degree. Yvonne, I would like to turn back to you. Can you please elaborate to the students what kind of backgrounds of students should consider taking up an education in the field of public health? And do you see a lot of international students opting for this field of study at US institutions?
Yes, thank you. Public health is certainly growing in interest as we look at international student enrollment. Our master's and PhD programs are well represented with international students in schools and programs of public health across the United States. At the Rollins School of Public Health, international enrollment represents 20% of our student population. And that tends to be a relatively steady average across many of our schools and programs of public health. We welcome students from a variety of disciplines, experience, and professional background. There is no one major that students must study in order to explore and continue their education in public health. And so we encourage students that are studying this field and looking at a possible match for their interests to explore further and to understand that the undergraduate training and education that they have received is likely a great match for a number of our programs. When we look at different requirements across schools and programs of public health, do pay close attention to some of the programs that might have specific requirements. So as was mentioned, the field of epidemiology and biostatistics relies heavily on data analytics and data science. And so those particular majors within schools and programs of public health might be looking for students that have a math background or that have at least taken a couple of classes at the college level in mathematics. So please be sure to explore those requirements, but know again that any major can be a great match for the study of public health here in the United States. And many of our schools have specific information for the application process for our international students as well.
Do you want to stay on this slide, Yvonne, and talk about it, or do you want me to skip it?
I cannot see the slide. Again, my apologies.
Okay. Dipti, even you cannot see the slide?
I think the slides are not changing. We are still in the organizations, right?
That's so funny because I prepared this. Can you see them now?
Yes.
Okay, so this was the slide that I was on.
Okay, thank you. When we look at the academic background of our students, and this is specific to the Rollins School of Public Health, but it can provide you an example. And we look again at the diversity of our students. We value the unique perspective that international students bring to our program, and I know that's the case for many schools and programs of public health as well. Understanding that public health is truly an international topic. Again, particularly looking at things like pandemics. COVID-19, as been said by many experts, does not know borders or cultures. And so having students that bring an understanding of a cultural perspective that can lend their expertise in understanding the health systems of their particular culture and country, this really provides a very rich dialogue for students in our classrooms. And so we really value and encourage the perspective that international students bring and the expertise and background knowledge that can be really helpful and beneficial to all of our students in the classroom. Most schools and programs of public health will require some kind of exam for entrance. This has really changed in recent weeks. So with the COVID-19 pandemic, at the Rollins School of Public Health, submission of GRE scores is now optional due to the pandemic and the lack of access to testing. This is the case for many schools and programs of public health. So we've listed some averages because some students continue to access this exam and to provide it as part of what they would like us to consider in the admissions process. But again, for the Rollins School of Public Health, this is waived for admission for fall 2020 and fall 2021. So the GRE is optional for these 2 years of enrollment. And you can see the average GPA for admitted students, undergraduate and graduate, being the same at about a 3.4 average GPA. Now, for our international students, of course, we're requiring the WES evaluation for many of our schools and programs of public health. And many programs also want to see either a TOEFL or an IELTS score to confirm our students English proficiency, so that we can both be certain that our students will thrive in our academic programs.
Okay, great. Thank you so much. I just request the panelists to let me know if they're not able to see the slides. So I'm going to turn over to my next question, which is for Deepthi from University of Louisville. Deepthi, for our high school students today or their parents who are in the session today, who might be interested in a public health major, can you please share information about the undergraduate programs and some of the general admission requirements for these programs?
Sure. Thank you, Monica. Yes, now we are on the slide.
Okay, great.
So, talking about the undergraduate program in public health, what we have learned and what we see currently is many students, especially international students from India or other Asian countries, they believe or they think that public health can be studied only at graduate level, like a specialization. But just to give you a heads up, public health is also available at an undergraduate level. Students can directly enroll into a Bachelors of Science or a Bachelors of Arts in public health. There are two options, curricular options that the students can enroll in. Many universities in US also provide like a accelerated program, bachelor's plus a master's degree, which is beneficial for students who already have made up a plan, like we will complete our bachelor's and then we will go for a master's in public health as well. So they can complete that in 3+1 or sometimes 3+2. So that kind of helps the student to finish a master's degree in a shorter period of time. There are also options available as minors. So many students who feel that I'm not ready right now to start with the bachelor's in public health, and I want to do a degree in sciences, for example, biology or nutrition or applied sciences, they can still go ahead and take a minor in public health. They can also do a minor in other programs like healthcare management, public health nutrition, and applied statistics and data science. So those are a few programs that we offer at our university, but if you go to various other universities' websites, which have undergraduate program in public health, you might see maybe some different minors or maybe some different curricular options in public health. There are various, as per the universities, various options available at the undergraduate level as well. The other option for students as taking public health is also for students who are planning to go into advanced degrees in law or clinical sciences. For example, many of our students who complete a bachelor's degree in public health, they later on apply for School of Medicine, School of Nursing, or dentistry. So this could also be a start point for students who are looking forward for an advanced degree in clinical sciences or in professional medical programs. Talking about the requirement for undergraduate public health programs, the admissions requirements are not that stringent or not that strict in University of Louisville. Every university again has their own requirements. So anyone who is interested in the respective university look for the admission requirement as described by them. For our university, what we require is a simple undergraduate online application form. From international students, yes, we require an English proficiency in TOEFL 79, for example, and IELTS 6.5. We will require all high school and college official transcripts. The minimum GPA requirement will be 2.5. Again, every university has their own requirements. We accept official test scores, either ACT or SAT, and we will be using the highest composite in the ACT. We do not super score, so students have to, understand that. We request all students to submit all the test scores that they have taken. We have also decided to go test optional. So if students have not taken ACT or SAT but still want to apply, we encourage them to apply. Many universities, we have seen that many universities going forward have made test optional. So, again, I request you everyone to go to respective universities' website and see whether they require test or not. We will also require a financial statement, which is to cover your tuition expenses and living expenses. So just to give you an idea, if we move to the other slide, the tuition, what we expect from students is to show that they have the capability of paying 1 month tuition, year of tuition, as international student fees, health service insurance, living expenses. So that's the financial requirement that students have to show to get the documents in order to apply for the I-20 and then the visa.
Okay, great. Thanks so much, Deepti. Yvonne, would you like to add anything about the undergraduate applications in addition to what Deepti just shared?
No, I don't have anything to add. That's a very comprehensive review. Thank you.
Okay, great. Okay, but still staying on you, I think it'll be nice if you can now elaborate upon Yvonne, can you elaborate upon the graduate level programs in public health that are available at US universities, including how should the students prepare a good application for these programs?
Great, thank you. And if you can just, thank you, advance the slide. So there are a number of graduate programs that are available for students that are seeking to study public health in the United States. Of course, we have our Masters of Public Health, and we also have our Masters of Science in Public Health. The distinction between the MPH and the MSPH, or the MS, is that typically at most institutions, the MSPH, or the Master of Science in Public Health, will have added quantitative requirements for students. And many of those students are seeking to go on to continue their career as a researcher and obtain a PhD sometime, in their career. And so that is an option that is available to many of our students. We do, of course, also offer PhD programs at many institutions across the United States. And there are also certificate programs that are available. Many of our certificate programs are available to students that are non-degree seeking. So if perhaps you've already had some professional background and experience, and you're looking to couple that with a specialization within public health, such as informatics, as an example, you can register for an online certificate program. And as we talk about graduate programs in public health, many of our schools also offer online programming for international students, so that many of our schools are offering this as an option, and students can remain in their home country. Just be sure that as you're exploring these programs, that you're looking at whether or not they're truly a fully online program, or if they are what we call a hybrid program that also invites students to come to campus. And as always, please be sure to consider any visa implications as you're looking at different modes of delivery of programs of study in public health or any other kind of graduate degree that you might be exploring. And when we look at general admissions requirements for our students, the application process for schools and programs of public health can vary by institution. So again, we encourage you to begin to do your research by perhaps using the ASPPH search, or by looking at individual websites of schools and programs of public health. Much like undergraduate schools in the United States, where there is one common application that students can use to submit their requirements to a number of schools simultaneously, such as the case with schools and programs of public health. Many schools are using the Sophist application, that's SOPHAS, and that allows you to select a number of schools and programs and to send your credentials to all of those schools and programs simultaneously. If you are considering a graduate degree in public health, we do encourage students to begin to look at the Sophist application well in advance. It is not a quick application that can be completed in, a few hours time. And so we really encourage you to begin looking at Sophist and to really make sure that you have a good understanding of how that system works. Again, the requirements from schools and programs of public health might be different, even though you might be applying through one centralized location such as Sophist. Most schools will ask you to select not only their school, but then a program as you're applying through Sophist. And then Sophist will verify your completed application and it gets sent to the particular school for their review of your candidacy. Most schools are going to require that you submit transcripts from every institution that you have attended as part of your undergraduate experience. Most schools are also going to require letters of recommendation. And again, how many is really individual by school of public health. Many of our schools are also requiring some kind of standardized test. Many schools are making the submission of those scores optional this year and next year. But again, please make sure that you're looking at those particular requirements by school. And of course, most of our schools are also going to ask that you submit a personal statement or an essay that really offers you the opportunity to personalize your application for admission to your choice program. And we can certainly elaborate more on the personal statement and what it should contain. We also would like you to submit as part of your Sophist application your research work, volunteers, or any volunteer opportunities or any honors that you have received. And on the Sophist website, you'll see that you are asked to input this data, but then to also upload a resume or CV that sort of explains and offers the reader or the committee a good understanding of your background and training as you're applying to schools and programs of public health. Those are general requirements that most schools are asking for. In addition, for our international students, many institutions are asking for an English language proficiency exam, and many of our partners that are offering these exams are offering them online so that students can access those readily. We're also going to require that you submit a credentialing document that helps us understand your curriculum in your particular country to ensure that it meets our requirements. So for many of our students, they're using the WES evaluation. And finally, once you are accepted to your choice school or program of public health, we're going to ask that you submit a financial certificate that demonstrates that you have sufficient funding for at least 1 year of study here in the United States. And so you want to be sure to take note of that requirement for enrollment as well. And I'd like to give you the opportunity to also learn about some key tips and advisement that might help your application process. Be sure that you begin your research early. Many of our programs here in the United States offer merit scholarships. These are scholarships that are based on academic performance, and many schools have a deadline for scholarship consideration. At the Rollins School of Public Health, as an example, we do offer students full tuition scholarships that include stipends for our most competitive applicants. Please be sure that you're doing your research and that you're prepared to meet those deadlines for priority scholarship consideration. You also want to be sure that you are looking at individual schools to understand the requirements for international students. Schools differ in terms of the credentialing agencies that they will work with, or the English language proficiency exams that they want to see from students. You should also consider applying for any kind of scholarship or financial aid early. Of course, that's different for international students because they are not able to access the FAFSA, which is a federal document that usually help students qualify for federally subsidized loans here in the United States. But for our international students, you want to make sure that if there are any local government organizations in your home countries that are providing financial aid assistance for you to travel and study in the United States, particularly in a field such as public health, that you're submitting those applications early. And also be sure to search for external scholarships. Again, the ASPPH website can be a great source for you to find some of those scholarships that are available uniquely for international students. So make sure that you are keeping in mind all of these deadlines so that you can have the best possibility of securing funding for your master's degree program. In terms of letters of recommendation, this is oftentimes a question that we receive from students. And our students, again, represent a variety of different backgrounds. And so we encourage students that are coming from directly from undergraduate institutions to make sure that they are submitting academic references, unless, of course, they've had significant professional experience. Then we really do want to see an academic reference coupled with a professional reference. We ask that, of course, no personal references be included, so nothing from family or friends, because we want to make sure that we are learning from people that have worked with you in a professional capacity. You want to make sure that you meet with your reference beforehand and that they are willing to offer you a positive letter of recommendation. And you want to make sure that the people that you're selecting can speak on your behalf regarding your leadership, your growth, the potential that you exhibit as a future public health professional, your skills, your character, your habits of mind. You know, are you a student that can be resilient? Are you a student that is truly committed to this work that in part really requires a commitment to public service? And so you want to make sure that as you're meeting with your references, that you're providing them with an updated resume, that you're perhaps sharing your personal statement with them and any other supporting documentation that might give them a clearer view and understanding of your potential as a student, particularly if you are asking for an academic recommendation of someone that you may have not had in class in the past year or two. You want to be sure that you're updating them. Please also give them sufficient time to write a positive letter of recommendation. Make sure that they are aware of the deadline for submitting that letter of recommendation so that you are meeting deadline requirements, and make sure that you're giving them ample time to do so. Particularly with academic references, know that popular professors and instructors are being asked by multiple students to write letters of recommendation, so do give them time. A question that comes up quite often is, should I try to secure a letter of recommendation from someone in a position of power if I have access to that person? So for example, a minister of health or a politician that has aligned him or herself with public health. And we always say that your letters of recommendation should really reflect and highlight your associations that have direct knowledge of your potential as a student, as a researcher, as a part and a member of our communities on campus. And so please choose quality over position and title. While it's nice to demonstrate your networking ability, what our faculty committees are really looking for are concrete examples and details around your ability to commit to a graduate level program and to be successful in the field of public health. Next slide. In your personal statement, you want to make sure to tell your story. So one of the things that I like to share with students is that our faculty that make admissions decisions and folks in the field of public health are very committed and dedicated to this work. And oftentimes they have spent a lifetime, their entire career, committed to the work of public health, and they're passionate about what they do. They want to see that you too have a glimmer of that passion and that you are going to have this commitment to serve others in this very meaningful and fulfilling way. So make sure that you're telling your story, that you are explaining your interest in public health and what led you to that interest. You know, we like to say that public health is a discovery-based career. So no one sits in their second grade classroom imagining that they want to be a public health practitioner. Perhaps after this pandemic, they will, because it has received so much more attention than years previous. But typically, students are coming to understand the role of public health and understanding that it is, in fact, a profession to pursue. And so make sure that you're talking about that discovery. Talk about any significant or relevant experiences that you might have had, and describe your observations, successes, and discoveries. So for many students, those are oftentimes examples of study abroad programs where they've had the opportunity to experience and see a different health system at work, or they are able to quickly identify some of the inequities that might be a part of that particular local health system's challenges. And so make sure that you're telling us about those experiences. Be specific about the academic program and career goals that you seek to obtain, and make sure that you are demonstrating, again, your commitment to the field of public health and what you hope to contribute to this field. Make sure that you source at least 2 people to read your statement. And I always like to say it's wonderful to have one of those people be someone that has had some professional background experience in public health, such as a faculty member or somebody that you have worked with in a professional capacity, but then also get somebody that doesn't know public health to read your personal statement, to make sure that it fully explains to someone that doesn't have the background a good understanding of your knowledge and commitment of this field. You want to make sure that you're avoiding cliches such as, you know, I want to help people, I want to save the world, I want to make this a better place. We know that, and we know that public health is oftentimes associated with service. And finally, grammar does matter. In addition to this being an opportunity to personalize your application and to give us insight as to you as a person, it is also a writing sample. So make sure that it is grammatically correct and that it represents one of your finest pieces of writing. So again, you're going through that writing process with multiple revisions and giving yourself plenty of time to write and revise a personal statement that not only tells us about you as an applicant and your credentials, but also is a great example of your work. One final tip here, make sure that your personal statement does not repeat your entire resume in prose. So remember that we already have your resume. So your personal statement should not be a storytelling of your resume. It should be a little bit more focused than that. And it should be really focused on your career goals and your particular interest in this field. Next slide, please. And as you're telling us about some of your experiences and as you're doing this as a part of the Sophist application, make sure that you're telling us about your volunteer work. If you're coming directly from undergraduate, tell us about your campus involvement and leadership. Those are important attributes that we want to see. And of course, our institutions are vibrant places where we want our students to contribute as part of the community. So if you've had some experience in doing that as an undergraduate student, please tell us about that. Also, be sure to highlight your research experiences and be sure to include any internships that you've also had the opportunity to participate in. Sophist will require that you're inputting these details, as was mentioned before, but that you're also uploading a resume or current CV.
Thank you so much, Yvonne, for putting together all this information in just a few slides. I think this is just wonderful. The various tips, that you've given to prepare a great graduate application. I think this is wonderful. Deepti, would you like to add anything about the graduate program applications in addition to what Yvonne just shared with the students?
Yeah, a few points, Monica. Thank you. Thank you, Yvonne, for that complete description. It's really interesting to see because, yes, we have to tell students about SOP, resume. So that was really great. Yes, few points. We already heard about the various master's and graduate programs available in the field of public health. These are programs that University of Louisville School of Public Health and Information Sciences offers in the field of public health. So in MPH, yes, you have various concentrations available. So you have to go to every university website and see what is available, what concentration you can apply for. Likewise, you can also apply directly for any major concentration as an MS degree instead of going for MPH. My advice would be to look at the curriculum to see whether you want to do, an MPH with that concentration or directly apply to that specialized program. PhD programs are also very popular in the field of public health. So many students who want to get into a master's degree, be sure to make, to see if that university offers credit transfer from their master's to their PhD, because that will help you save some time and credits. Many universities also are now offering online programs. So these are few online programs that we offer. Looking at the new normal right now, the pandemic that we are going through, online programs are getting very popular, and many universities are also giving an option of credit transfer from your online to your on-campus program. So just to give you an example, our program in MS in biostatistics, we offer that online as well as on campus. So if you're not comfortable right now, let's say to come to United States and start your semester in fall, you can start an online program, and maybe next year when everything gets normal and you feel that you really want to come here, have a campus feel, you can transfer those credits from your online program to the on-campus MS in biostats and complete your degree on campus. So there are many things available. I would request students to go to universities' websites and see what changes are coming up, what new things are happening for fall or for 2021. Next slide, please, Monica. Right. We already spoke about Sophist. We also require application through Sophist, but not for all our degree programs. So again, a good example would be to go to university website and see which programs accept Sophist application and which do not. There are a few exceptions on Sophist as well. So every university has that. Our exceptions are, for example, if you're already a university alum, like already graduated from our school, you don't have to go through Sophist. You can directly apply to us. I'll not take much time on this. Graduate admissions, we covered all of this. Yvonne has done a great job telling us about the graduate admissions requirement for public health graduate programs. The one thing that I would like to add is about the requirements for specific public health programs, like, for example, MS Biostats, MS Health Data Analytics. Those programs might require a math background or a statistics background from students, like calculus, etc. Many applicants might not have that, but still they can apply. How they can apply is many universities are offering extra courses, or for example, what we offer is a math tool. So if anyone do not have a background in mathematics or stats, but still is very keen in doing MS in biostats or learning about health data analytics, they can do a summer math tool program, or maybe a course before the start of their semester, complete the math tool, take the test, clear it, and then are eligible to apply to the programs wherein the calculus requirement is there. Few universities, they also have maybe an interview requirement. So apart from your general admissions requirement, once you submit your application, make sure you follow up with the admissions team of that university. Make sure you check your emails and see whether you have been selected maybe for a virtual interview or a virtual conversation, because many universities are also interested in meeting their students before they send them the admit. Yes, I think that's pretty much, Monica, on the graduate requirement. This is the tuition rate, just to give you an idea about the tuition rate at University of Louisville. That's it.
Okay, great. Thank you so much, VP, for putting on all those additional things in addition to what Yvonne shared. My last question now, and this is for both institutions, this is especially targeted for the master's and PhD students, and also for the bachelor students who want to offer honors degree. What is the scope for research in the field of public health? Whoever wants to go first, it's fine, DP or Yvonne or Tammy.
I'm happy to start. I would encourage students, every school is a little bit different as far as research opportunities go. Those are typically guided by the faculty members that are at the school, and they may be working on funded research or unfunded research. Even as a master's student, if you have an interest in pursuing a doctoral degree, I would encourage you to get involved in research. That way you're building your resume for your application to the doctoral program. Research aspects in public health vary. I mean, they are very broad. Our list, if you see the slide, is everything from health policy to, we just started some COVID-19 research, to HIV, stigma, LGBTQ health, reproductive health, nutritional and molecular epidemiology, cancer epidemiology. So I would tell you that once you got to the school that you've applied for, and if research is something you're interested in, I would explore the faculty members' area of interest and research interest. That may be on their website. That may mean scheduling meetings with faculty and talking to them about their area of research. And then you may want to volunteer. A lot of times, especially if it's unfunded research, it may be unfunded, and the faculty member is hoping to have some preliminary data in order to submit for a funded research proposal. And so volunteering is always a good thing. I know everybody wants to get paid, but in this particular instance, being able to say you had that experience and you worked on a research project, especially if you do plan on applying to the doctoral program, is extremely beneficial. So get to know your faculty, get to know what they're interested in, what types of research they're working on, what types of research they are planning on working on. Generally, most faculty members will have an area that they are the expert in and very passionate about, and that will typically become their niche. So get to know the faculty at your school after you've been accepted. Make sure that they're aware that you're interested in volunteering for a position, or if there are any paid positions available, that you're interested in that. But go in definitely with the idea that in the beginning, it'll probably be a volunteer experience. A lot of times faculty will say, yes, you know, I'd love to have you volunteer. And if they get a funded project and you've done really well and you've been an asset to the research team, they will often either offer you some sort of research position, and that can be a fully funded research assistantship, or it might be, we have lots of faculty that will pay an hourly wage for research help. So know that that's an option if that's something you're interested in, and I would encourage you very strongly to get to know the faculty and their area of interest, and then what grants have been funded. And often there's an associate dean for research within the School of Public Health, and you know, you may want to set up a meeting with them and talk to them about the faculty research and what's going on in the school and what long-term looks like as far as over the next couple of years that you're there, and if they know of any research positions. Making those contacts early is always a benefit, because that way faculty talk and staff talk, and when they say, oh, I have a research position available, and if you've already approached them or you've let somebody know you're interested, oftentimes they will say, well, have you talked to student so-and-so? I know they're very interested in working on research and gaining that experience. And it's particularly important if you plan on going into the doctoral program and want to apply to a doctoral program, whether it's at that particular school or another school. They will, 9 times out of 10, their admissions committee is going to look for any research experience that you've had, whether it's data collection, data analysis, and if you're really fortunate, you'll be working with a research faculty member who will allow you to learn all aspects of the research process, and that includes making presentations, writing a paper, and getting the full experience, so that way you can adequately speak to that if you do apply to a doctoral program and get an interview. And that's all I have.
Okay, thanks so much, Tammy. Yvonne, would you like to add anything to what Tammy just said?
Oh, thank you, Tammy. That was really helpful, and I think great information to help our students seek research experience. The only thing that I would like to add is that at most programs, the onus really is on the student. And so you want to make sure that you're developing relationships with your faculty members, really get to know them, look for a way to become involved on campus so that these conversations can flow a lot more comfortably for you. And know that research experience is also very important if you're looking for a job after you graduate, even outside of a research field. The skills that you will learn as a researcher, the ability to work as part of a team, the increased understanding of public health in an applied sense will all be valuable attributes. So make sure that you are seeking those experiences and that you are learning how to network and how to develop these kinds of relationships that will help you grow in your profession for years to come.
That's perfect. That's great. Thank you so much, both of you. And I take your permission to share first your contact information with the students, because that's where we are now ending up panel discussion part of the whole session. So on the screen, students can see contact information for both the university representatives that not both the university's representatives. So we have 3 representatives actually. So you can see on your screens their contact information. Feel free to contact them. I'm going to also share the contact information for our centers, the education centers across India, before I open up the audience questions, because I know that sometimes it happens that it's almost time for the session to get over and students start to leave. So I don't want to miss out on sharing the information, the contact information for our representatives with the students. This is the contact information for our representatives. As I said, I'll also maybe we'll stay here for a minute, and so that the students and audience can note down the information. And we can take a few questions, and then I'll share the information for our contact centers across India, so students can get in touch with the Education USA centers if they have any general basic questions or even advanced questions related to US universities. What I'm going to do is I'm going to read out the questions, because I already see a lot of questions actually have come from our audience. So I'm going to read out the questions for our panelists, and they can answer those questions for the students. Okay, let's go start from the beginning. Okay, there's a question by a student. What kind of opportunities can a genetics major find in public health? Anyone who wants to answer? Yvonne, the third time.
Can you repeat the question, Monica?
Yes, what kind of opportunities can a genetics major find in public health?
I can definitely take that. So a genetics major in public health has a wide range of opportunities. Epidemiology is definitely an area that you may be interested in. Now, when you say, I'm not sure about the genetics background of the person that's asking the question, if it's bench research. There is bench research that does go on in public health. It typically goes on more in medicine, but lots of schools of public health collaborate with their schools of medicine if they have one. So as far as geneticists go, it may be everything from cancer to you may be looking at environmental health factors that may influence genetic issues. So depending on what the particular person is interested in, I would say they should look at possibly epidemiology as well as environmental health as areas that in public health would help them further their genetic skill set, especially if they have some bench research and can work with a school of medicine or a particular bench research department. They may not have a school of medicine necessarily, but they may have other opportunities, such as a biology department, maybe something that they want to look at if they're looking at schools of public health to see what types of bench research is available. I'm assuming this person is a bench researcher, and so I would tell them to take a look at biology. If there's a school of medicine, they might want to look at Department of Toxicology, Pharmacology. It really depends on if there's a specialty that they're interested in, or a particular problem, a particular genetic issue that they have an interest in. But within a school of public health, it would be epidemiology and environmental health would be the two particular areas that I would focus on. Now, there are a couple schools that actually have a genetic area, and this person, one of the participants, could go to the Sophist website, sophist.org, and you can search by area of interest, and that way those schools that offer that particular area will come up. So I would encourage them to do that.
Okay, great. Thanks so much, Tammy, for the answer. We have a few questions coming in for people whose status shows that they have left the webinar. I'm just going to read out those people's names. If they're still there, I request you to please type in your question again. Thomas Burkes, you had put in a question, but you have left. Subha Bhavana, you also show as left. Sudarshan has left. They had a question. I'm going to take the next question. If three of you, you're still here, just type in your question again. The question is doing a dual degree in MPH and Masters in Social Work beneficial? Dual degree in Masters of Public Health and Masters in Social Work.
I can speak to that because I have a degree in social work. I would tell you that it depends on the number of credit hours. Dual degrees with schools of social work are typically very difficult because of their accreditation requirements and require a large number of credit hours. If it were me, I would look at the number of credit hours that's required for the dual degree, and I would decide if it would be more beneficial to do a master's and then go on and get a doctoral degree. Again, schools of social work will require it's a minimum of 60 hours if you don't have an undergraduate degree in social work for most schools of social work. It could be a 30-hour option if you have an undergraduate degree in social work. But the schools of public health typically will range between 42 and 45 hours. And I've seen some of them that are over 70 hours if it's a dual degree, or as much as 80 hours. So I would tell the person to really pay attention to the credit hours and make a decision based on that. I'm not sure that a dual degree, to be very honest with you, and I'm sure my colleagues at the School of Social Work would not be happy with me, but I'm not sure a dual degree is going to get you anything more than either a master's in social work or a master's in public health as far as career opportunities go, and based on the number of credit hours that you're going to have to complete and the possible cost of the program. So I would definitely investigate that.
Okay, that's fun. Thank you so much, Tammy. Yvonne, the next question is for you. One of the students has asked that for evaluation of a degree, applicants have to pay around $200, which is really expensive and time consuming. And the student is wondering if Emory has any alternative path to avoid this.
Yes, unfortunately, we do not. In order for us to understand degree requirements and to validate degrees from countries really all over the world, we need credentialing agencies to help us with that work. I will say that there are application fee waivers that are offered through Sophist. We are not able to grant fee waivers because, again, that application is going through the Sophist network, but please do log on to Sophist and just key in application fee waiver, because many times you're able to secure a fee waiver in that way. Additionally, there are actually 3 programs that you can apply to at Rollins. So what we ask is that students submit 1 program when they're applying through Sophist, and once we receive your application, we will email you an ask you to select 2 other programs of interest. In the event that you are not granted admission to your first choice program, you will be reviewed by 2 additional programs. And we do it in that way so that you're not submitting those 2 extra applications for admission through Sophist that do incur fees. So we are mindful that the admissions process in of itself can represent an investment for students.
Okay, great. Thanks so much, Siobhan. That's really helpful. Bamidale, there was a question from you, but you've already left the chat. Please drop us a message again if you're still there. The next question, can we have the recording for the session? Some of the students have missed, I think, for some time. There is a recording available once the session finishes. You will be able to access this through the Gotowebinar login, the same page where you registered. The next question is, and I think any one of you can answer it, how is an MS program different from an MPH program? I think one of our panelists did mention the differences, but I think it'll be good if one of you can explain again the difference between the MS and the MPH programs. Yvonne, do you want to go ahead?
Sure. So typically an MS program will have added quantitative requirements. So as an example, some of our programs such as Epidemiology, you can select either an MPH or an MSPH. The MPH is a 42 credit hour program. The MSPH is a 48-hour credit program. And those extra credits are, again, typically offered in quantitative areas and really signal an interest in research on the part of students. Many of our MSPH students are thinking that perhaps at some time in the future, they will invest in a PhD degree.
That's perfect. Awesome. The next question is, what are the requirements for a certificate course? I'm not sure what do they mean by requirements. I'm guessing it's the admission requirements they're talking about. So what are the admission requirements for a certificate course in public health?
I can answer. Okay.
Go ahead.
Yeah.
Sure, go ahead.
So I think the admission requirement for certificates program will completely vary from what kind of program you're applying to. For instance, our school, we have certificate in biostats and certificate in clinical investigation sciences. So the major differentiation is that if you apply for a certificate program, then your test, for example, GRE is not required. We do not require an or we do not require your, we require less references. So it completely depends on what program you're applying for and what would be the requirement. So I think the major difference would be just the test optional. That's it in certificate.
Okay, great. Yvonne, did you want to add anything to what Deepti just said?
I would just add that students seeking a certificate program should clarify whether the institution is offering a certificate for a degree seeking or non-degree seeking. So we offer both kinds of certificates, and that can be something that will include different requirements based on the type of certificate being obtained.
Okay, perfect. The next question is related to PhD programs. The question is academic publication necessary for PhD admissions? And if yes, then how many are needed?
I can take that question.
Okay.
It really depends on the doctoral program. Typically, most doctoral programs don't require a number of publications or a publication at all, because unless you've been really fortunate and had that opportunity in your MS program, many students are not in a place where they will be able to publish their research unless they have a mentor in their MS program that really allows them that opportunity and works with them. So it's not typically a requirement, and there's if you do have one, that's great. But again, typically most doctoral programs know that an MS program can be 2 years, and that's can be a very short amount of time, and not, they would rather have you focus on your coursework and see that your grades be really as best as possible. And it's really hard to do research and get a publication out in 2 years, because it may take up to a year to even be accepted once you submit the publication. So it's, again, it's typically not a requirement.
Okay, great. Thanks so much, Tammy. We're receiving a lot of comments on how informative the session was. So thank you so much, panelists, for that. Yvonne, did you want to add anything to what Tammy just mentioned? I know when you come on the screen, okay, all right. I thought when you come on the screen, I thought you wanted to say something.
Thank you.
I think there are a lot of students who are putting in their comments that they really love the session. So thank you so much, all of you. I'll move on, but I'll also side by side change my slides for people to just note down the contact information for our centers. I'm going to just leave that on. As I said, we have 7 centers, so people can note down the information for the closest Education USA center and get in touch with us. I hope you all noted down the contact information for our panelists today. So moving on to the next question. The question is, can I volunteer for a research from India at a US university? I know this is not completely relevant to the panel that we discussion that we were doing, but do you think any one of you from a public health perspective can answer that question? Can a student from India volunteer for a research at a US university?
I think that there needs to be an affiliation with the institution in order to participate in the research. So as an example, if there is an organization or research project within your home country that an institution is affiliated with, then it might be possible to do that. So as an example, we have a Center for Diabetes Research at the Rollins School of Public Health, and one of our faculty members is competing for a MacArthur grant that would give him the opportunity to expand some of the access to prevention of hypertension and diabetes. And that research is happening in India, and the grant would be implemented in India. His research team travels there quite a bit and has an installation there. And so that kind of organization and ongoing work would likely be an opportunity where a student could volunteer if you were to research that particular organization and connect in your home country. Otherwise, I do think that it could be challenging unless there is already some kind of affiliation with the university.
Absolutely. From an education advisor's perspective, I can comment on that, keeping in mind also the visa requirements that students would have to go from here to the US to do anything, whether to study or to work or to do research. The two possibilities, as Yvonne also mentioned, is to be affiliated with a project at an US institution which has a campus or a project ongoing and on Indian grounds, or in some extreme circumstances, we have seen students building up that affiliation that Yvonne just mentioned, to get a research assistantship or research associate position at a US university, and then for a short-term duration, go there to do that work. But that's not volunteering, that's more like a work that they can follow. Okay, so moving on to the next question. I am a student of biotechnology at the undergraduate level in India. What is the best stream within MPH that I should follow to get a job in the US? So this is an undergraduate in biotechnology and would like to pursue an MPH and wondering what is the best stream of study for them within MPH.
I could answer the question if I knew a little bit more about what falls under biotechnology in India.
So it's biotechnologies. It's again, the cellular level work, and cell and molecular biology, but more into also spans across genetics. It could be drug development. It could be looking into the diseases at the molecular level. So it's the same thing as in the US. Biotechnology will be the same as it is in the US as well.
Okay. I just wanted to make sure that there wasn't a big difference. I would encourage them to look at epidemiology. Again, a lot of what I said with the previous question regarding genetics, looking for opportunities on campus for bench research experience, but they could definitely use their skill set and either get an MPH with a concentration in epidemiology, or long-term, if they wanted to get a doctoral degree, they could get an MS in epidemiology and continue on. Hopefully some of their research experience could be used in the MS degree.
Okay, great. The next question is for both universities, and a student wants to know if both the universities have a spring intake.
No, we do not have a spring intake. All our session starts in fall, except for the online programs. So on campus, it's only for fall.
We also do not have a spring intake. Everything starts in the fall.
Okay, thanks for clarifying. The next question is from a student who is doing a MD in homeopathy, and the student is interested in a research field. So which type of course is suitable for me? MD in homeopathy.
I would say that for a student who has done medicine or MD in homeopathy, they can apply for public health sciences program in health management, because since they come from a medical background, many of the students, they want to study the healthcare management aspect here in United States. So that would be a very good study prospect for those medical graduates.
Okay, great. I know we have, surpassed the 6:30 p.m. India time, but would it be okay if we keep moving on with the questions for another 15 or so minutes? This is the question for the panelists. Students are still here. Would that be okay if we continue? Fine. Yvonne, are you also okay?
Yes, I am also okay.
Thank
you.
All right, that's great. Thank you so much, both of you, for confirming. Tammy, I'm also assuming that it's okay with you. That's fine?
Unfortunately, I have another call in 6 minutes and I have to get off.
Oh, I'm sorry about that.
No
There's so
problem at all. And have any student feel free to reach out to me, and I'm happy to answer any questions they have.
Perfect. So I will assume that when you leave, when it's time for you to leave, you'll be leaving. But thank you so much for joining us today. We will have BP here, I think, till the end to answer for University of Louisville. And Yvonne has also promised to continue. So thank you so much, Tammy. Whenever you have to leave, please leave. I'm sorry we have overshot the time.
No problem. Thank you very much.
Okay. Yeah, great. Thank you so much, Tammy. Okay, the next question is by a student who's asking, what kind of research work, volunteer experience, or internships are required before getting into the master's degree? I know, Yvonne, you answered, you elaborated upon it. I'm not sure who wants to answer, but one of you can talk about it. What kind of research work, volunteer work, internships are required before getting into the master's degree?
That's a great question. There are no true requirements in terms of the research, particular volunteer hours that many schools and programs require. However, we like to say that public health happens in any space. So as an example, if you during your undergrad years volunteered as a tutor for example, add an after-school program for children, and you notice that some of the socioeconomic disparities truly had a health impact on students, then that is the work of public health. That may not be directly the work of public health, but that is something that you could certainly mention as a meaningful connection to your discovery of public health and your interest in pursuing this further. Most schools and programs do not have specific requirements that say you must have done this kind of research or participated in this kind of volunteer experience. And so do check out the individual programs to confirm that.
The next question is how and where to find an accredited college that is offering a master's in public health program. How and where to find an accredited college that is offering a master's?
I would say please visit the CEPH website. That's CEPH. They list all accredited schools and programs, and they also define what the accreditation characteristics and requirements are. They also define and enumerate the schools that are pending accreditation so that you will have a complete list.
I'd like to add that you can also contact one of your EducationUSA centers that are listed on your screen right now. Also, we do have some handouts and some great websites that we can refer to you where you can find accredited programs in addition to what I just mentioned. The next question is, can one pursue a PhD program despite the MPH program instead of an MS degree? I think that's a very good question because I think we talked about MS program being a stepping stone to get into a PhD. So the question is that can one pursue a PhD despite having an MPH degree instead of an MS?
Yes,
Absolutely.
I would definitely say absolutely they can apply.
Okay, that's perfect. Okay, the next question is, I think we already answered the difference between the MPH and MS. The question has come in again. Biotech, I think Tammy just explained. Okay, I'm good in decision making and research. So what kind of masters in public health is suitable for decision making and research?
I would say decision making and research is involved in every public health program. So it's very generalistic to say that. But if you mean by saying a decision making in terms of healthcare administration, policy making, or the management aspect, then healthcare management or healthcare policies would be the best field for you to go for. But just giving you a heads up, decision making and research is involved in every specialization in public health.
Perfect. The next question is that for master's admissions also, do you really need publications in peer-reviewed journals?
It's not a mandate. It's completely, an additional thing that you can add to your profile. It's nothing that any university might ask you as a requirement unless they have specifically mentioned it on their programs. So again, please visit the specific program website and check the admission requirements.
Okay, great, thank you. The next question is, does the age of a potential applicant have an impact on his or her competitiveness by the admissions committee? And I think the same candidate asked, is there funding available at PhD level? So I think the first question is about the age aspect, and second is about the availability of funding for the PhD programs by the same candidate.
Sure, there are no age requirements, and in fact, most schools and programs of public health will have a diversity statement that includes that we do not discriminate against any particular age group, and that is not a factor as a part of admissions decisions, as long as you meet the requirements for that program. And so there is no age requirement. Some programs do require professional work experience for a particular number of years, but again, that differs by school, and so you'd want to research that on your own. And I'm sorry, Monica, what was the second part of that question?
The second part of the question was that is there funding available for PhD programs?
There is funding available for PhD programs, and in fact, many programs will offer fully funded PhD programs. That is not always the case with master's programs. And so know that many students are first investing in a master's program and then possibly going on to have their PhD fully funded. But there is lots of opportunity for fully funded PhDs in the US.
I just want to add to what Yvonne's mentioned about it, having myself gone through that pathway of PhD and related to the field of healthcare in the US, that nobody can promise you funding because PhD programs in the US are not only competitive to get in, but also at every stage during the PhD program, there is a benchmark that you have to achieve. So you might be promised funding for first year, but then you have to complete a candidacy exam at the end of first year, and then your funding will continue and meet a certain GPA requirement to have your funding continue. And then you have a comprehensive exam at the end of second year, and then you have to do a proposal defense at the end of third or in middle of fourth year, and then you have to do your final defense. So each stage, of your PhD program is benchmarked for you to accomplish a level, and then your continuity into the PhD program and continuity of funding is something which is promised. So your performance does matter, is what I think, not only for the PhD programs, for all programs, but definitely if you are seeking funding every year, you will have to perform and showcase yourself that you have achieved that benchmark to be able to have the continued funding. Okay, moving on to the next question, and I'm not sure if this is under the purview of any one of you, but the question is that I have completed a PhD in specialization of environmental health. Are there any possibilities for postdoctoral fellowships in the field of public health?
Now, currently we do not offer a postdoctoral fellowship. As a PhD candidate, if a student has already completed PhD in environmental health in our university, if they want, they can go for a next PhD in some other specialization, but we do not offer.
Okay, great. The next, Yvonne, do you want to?
I was just going to mention, yes, we do typically offer postdocs, and that those opportunities are typically posted on our website as full-time job opportunities.
Okay, perfect. That's great. So students can look up the university website and find out about those postdoctoral positions. The next question that's just pouring in is, I am a postgraduate in statistics, and when they say postgraduate, I'm sorry about the noise from my background. It's the mosquito spray that they do at this time of the day. So that's the noise that you're hearing from the background. The question is from a student who says, I'm a postgraduate in statistics and have a 3 years experience in data science. Can I apply for a PhD program with this background? And when we say postgraduate in India, it means a master's degree. Postgraduate in statistics with 3 years experience in data science can apply for a PhD program with this background.
We do get few applicants when they directly apply for PhD degrees without, you said postgraduate, so he already has a master's in statistics, right?
Yeah. I have a master's. Yeah,
so yes, he can directly apply for a PhD in programs like biostatistics or any data analytics program offered at universities. So yes, he can.
The last question I think I would like to take for today is, the question is, can I be a hospital administrator if I pursue an MPH degree?
Yes, you can be a hospital administrator as well. It depends on the concentration that you have taken in MPH. For instance, MPH in health policy or health management could be one area where you can look into.
Add anything? Okay, perfect. And that was the last question on my list, which came in just now. I think we should wrap up. It's we are already 20 minutes over and beyond our time. But what a wonderful session. I think I would like to just take these last 2 minutes to thank our panelists for their time, effort, and the wonderful guidance that they've given to both students and parents who want to pursue a public health education in the US. Thank you also to a wonderful audience for being so patient, listening intently, and asking some very starking questions. With that, from all of us here at Education USA, we wish you good health and safety, especially in these challenging times. Take care and have a good evening. And thanks again, all of you, for waking up early and doing a wonderful session. Thank you so much.
Thank you, Monica. Thank you.
Thank you.
Thank you.
And students are free to contact the two panelists. They already shared their contact information. I'll maybe put that again on the screen for students who missed to note it down. For Education USA centers, our information are currently on the screen. So feel free to contact them. This is their contact information on the screen. Thank you so much, Yvonne. Thank you so much, Deepti.
Thank you.
And I already thanked Tammy, who already left. But have a wonderful day and stay safe and healthy. I know these are very challenging times, especially if you're in US with both corona and the current unrest which is going on in the country. I'm really sorry
Thank
for
you.
what's, yeah. Thank you so much. Yeah, take care, bye.
Bye.